That's right, you read the title of this video correctly. I'm going to show you how chest physiotherapy can be related to eating a hamburger and fries. This is exactly how I share chest physiotherapy with my patients and with the parents of my pediatric patients. This video is going to be a lot of fun. We're going to take a little trip, so I'm really excited to make it for you. But before we go, what is chest physiotherapy? Chest physiotherapy is a type of therapy that's used in patients that need to clear secretions or mucus from their lungs. It's used in patients with bronchitis and pneumonia. Also, patients with chronic lung conditions like cystic fibrosis and ciliary dyskinesia, they use chest physiotherapy daily or multiple times a day to help keep their lungs clear. So before we get going, I'm going to share with you a little bit about some anatomy of the lungs. This will help everything to make sense as we go. So your lungs are basically a bunch of tubes with air sacs at the end. So these are the tubes. And these are your lungs. The large tube is your trachea. You can feel your trachea running right down your throat right there. It goes down, it splits at the carina. This part right here is called the carina. And then it goes into both lungs. Those tubes split over and over and over again. In adults, they split over 20 times before they get to the deepest parts of the lungs. All these tubes split over and over and over again. And patients that have a lung disease like pneumonia or bronchitis, they end up with secretions or mucus inside the lungs. So I'm going to show that in this right here. Now, the goal is to help move the mucus from these parts of the lungs up to these parts of the lungs so that the patient can more easily clear it. So we're ready to go. I got this camera here, so you're going to come with me. We're going to go for a ride. Hey, can I get a border burger and order of fries?
For you to go.
To go.
What's your name?
John. Thanks. Thanks. Got some hamburger and fries. I'm really hungry. I haven't eaten yet today. This is the key right here. This is the link, and I'll show you what I mean by that. What I say to the parents especially is I say, hey, look, you have a burger and fries, and you want some ketchup on that burger and fries. How do you get the ketchup onto the burger and fries? They usually tell me to tip it over or to pound on it. And well, the first step is to undo the cap, of course, but then the next step, of course, is to take that bottle of ketchup and to turn it That's the key. You want to turn it downward. And I'll show you with the lungs right after I get this ketchup out of here. There it comes right now. There we go. That's how you mobilize secretions. You tip it upside down, you put your patient in Trendelenburg or on their side, and you pound them or you vibrate it. See, just like that. That's how you do CPT. So what happens is this. See, we want to use gravity. That's what we want to use. So looking back on our picture here, if our patient's sitting up like this and we start applying percussion to the side, well, that mucus is just going to settle on down to the bottom. It's not going to be moving towards where the patient can more easily cough it up. So what we have to do is we have to tip our patient either on their side or into a Trendelenburg position and then apply the percussion. Because if we do that, then the mucus is going to start moving this way towards the larger airways, and the patient's going to be able to cough it out a whole lot easier. So that's how CPT is related to eating a burger and fries. So if you'll excuse me, I'm going to eat this and then I'll get going. I want to mention too today that I'm recording this video. It's my mom's birthday today, so happy birthday, Mom. I'll see you in the next video.